If I were to ask you, what group of diseases is characterized by really inflamed muscles that grow progressively weaker and, depending on its origin and cause, can lead to having a rash and may or may not cause pain, and also has something in common with Alzheimer's disease? What would you guess? Let's see if you're right. Answer this way. Hey guys, all right, so this video actually kicks off the highlight that I'm going to do on the last Sunday of every month, putting the spotlight on one chronic illness that we all need to learn more about, that maybe you want to learn more about, and we can support as a community. So going forward, in the comments, let me know which disease you would like me to highlight. All right, without further ado, drum roll please. The answer is myositis. Did you guess it? Maybe? So myositis is a group of diseases that are characterized by progressive weakness. It can really progress into significant weakness. A lot of these people who have myositis will actually notice that they're having trouble walking upstairs, or they're having trouble standing up from a sitting position. And some types of myositis go away on their own, and then some are chronic. Myositis is treatable, but it doesn't always respond to medication. So one of the things we're going to talk about today is how it's diagnosed, what some of the treatments are, and just learn and dive into myositis in all its forms. And about 50,000 Americans are undiagnosed with myositis because the general thinking and belief here is that they assume the symptoms are because they're similar to muscular dystrophy, that's what they have, when in reality it may be a form of myositis that maybe is not so clear cut. So there's 4 different types of myositis, and the first one we're going to talk about is dermatomyositis. So with this particular form, you'll have the muscle weakness and the muscle fatigue, but the most notable thing about dermatomyositis is people develop a rash. It's a reddish, purplish rash all over, usually on their face, and it can be on their chest and neck and shoulders. And they also have calcium deposits under the skin that lead to kind of really hard, bumpy skin all over. And the muscle weakness that comes along with dermatomyositis is usually closer to the trunk. Again, so people are having issues standing up from seated positions, walking upstairs. They just feel just weak. There can be some lung involvement as well, leading to some difficulty breathing. And women are 2 times more likely to suffer from dermatomyositis. And the next type of myositis we're going to talk about is polymyositis. And this is when the white blood cells invade the muscle tissue and do damage, again leading to severe weakness. There can be some lung involvement as well, and the risk group increases with age, and the highest rates are usually between 35 and 45, and then again at 55 to about 64. And here as well, women are 2 times more likely than men to be diagnosed with polymyositis. So I personally work with a lot of people who have been diagnosed with myositis, all different types: dermatomyositis, polymyositis, and the next one we're going to talk about, which is inclusion body myositis, which is again characterized by severe progressive weakness, muscle wasting, dysphagia, which is trouble swallowing, weak wrists and fingers possibly, and atrophy of the forearms and possibly the thigh muscles. And again, this is kind of where the issues come with walking up the stairs, standing from a seated position, we discussed earlier, in the other types of myositis. These people will also be seen to have frequent falls. You know, in these age groups, if somebody comes in and they're exhibiting these symptoms, usually, you know, the physician will kind of look at the patient and, you know, already be thinking, well, you know, this could be myositis. There are certain tests we need to do to, you know, maybe figure out if that's the case. And we'll get into that a little bit later in the video, but, you know, we'll do things like an EMG. The actual physical is actually really important in diagnosing myositis as well. Inclusion body myositis, also known as IBM. The incidence of this also increases with age, usually 50 and over. So as people age, this is something that, you know, may become a little more frequently diagnosed. But also, the interesting thing here is that people may also develop symptoms of myositis as early as their 30s. So this is the one that can present a lot earlier than, you know, mid to later life. Juvenile myositis is the next one we're going to talk about. And yes, unfortunately, children under the age of 18, commonly between 5 and 15 years of age, can also be diagnosed with this. And again, it's a lot of the same symptoms that the adults experience. The most frequent form of juvenile myositis is juvenile dermatomyositis, in which the muscle weakness and the skin rash are there. Some signs and symptoms and tip-offs that the doctor may notice is the child has trouble lifting their head. There's some swelling or redness around the fingertips, which is really kind of interesting, and the fingernails. So some swelling and redness around this area of the finger. So if a child comes in and they don't seem to be in control of their muscles. You know, children are so active around the age of 5 and even 15. You know, we're getting into the teenage years, but a young child of 5, you expect to be, you know, running around, getting into things and situations like that. So when they come in and their mom or dad says, you know, the child seems to be super lethargic or just really kind of weak and just not themselves, and they're also having trouble lifting their head, and they're maybe seeing this rash around the fingers, then that's a pretty clear indication that that's what this might be. So what exactly is happening with myositis here? What exactly is going on with this chronic disease process? And myositis is essentially a problem with the immune system. It's gone haywire and it's actually turned its attention onto its own muscle tissue and skin, organs, connective tissue. And it's attacking them and it's destroying these muscles. Common causes of myositis are viruses like HIV, the flu, rarely bacteria or fungi sometimes, and other organisms can cause it as well. So viruses and bacteria will invade the muscle and, you know, take a wrecking ball to it, you know, and set off a cascade of what we see when somebody comes in with these symptoms of the weakness and maybe the skin rash and things like that. It can also be caused by inflammatory conditions like lupus and scleroderma and rheumatoid arthritis. All of these are inflammatory conditions, autoimmune conditions where the body is just not its own friend. It's its own worst enemy. And in these cases, again, I've said in many other videos that you know, it just seems to be such a prevalent thing nowadays. I don't know what that's attributed to, if it's our genetically modified food or our water supply, who knows? You know, it's difficult to say, but it seems like autoimmune disease has always been around, but it just seems like in the 30 years that I've practiced, it's taken a front seat to everything out there, unfortunately. Certain medications can also lead to myositis. Ironically, we're going to do another video on Guillain-Barré and talk about the COVID vaccine and the fact that I've had multiple people come across my desk who have had the COVID vaccine and are diagnosed with Guillain-Barré or chronic fatigue or a few other chronic diseases that we'll talk about, but I digress. So the medications that can actually lead to myositis, the biggest one for me, because I used to work with a pharmaceutical company that made an alternative medication to statins. And it's because a lot of people, you know, it seemed like everybody was put on a statin at one point. You know, high cholesterol is rampant again because of our diets here, at least in the States. So people would wind up on a statin, and, you know, sometimes within a few months or maybe after a year or so, they would turn around and just be feeling so weak and so fatigued and so tired. And the statins are one of the biggest contributors to myositis. And I've had plenty of people come to me for IVIG therapy, which again, we'll talk about in a little bit, but you know, they had been on statins for a period of time and then just grew progressively weaker to the point where, you know, they went to their doctor and you know, obviously this wasn't normal, and lo and behold, they were diagnosed with myositis. And notable mention for other medications that can also lead to myositis: cocaine and colchicine. So we've talked about the different types of myositis, but now we're actually going to talk about how it's diagnosed, what kind of testing is done, and what kind of physical exam findings, you know, a physician might look at and say, oh, you know, I think we better test you for myositis or some type of inflammatory muscular condition. So I want to stress the importance of a really good physical exam. If you are having these symptoms, you know, if you're having this weakness, or if you're noticing a rash anywhere on your body, or you have any other symptoms, difficulty breathing, etc., and you fall into one of these age groups, go see your doctor. The physical exam is actually where it all starts. The doctor will look at everything and then possibly send you for an EMG, or this is muscle testing. It's an electric current pushed through your muscles to see how they're stimulated and how they respond to this stimulation. I can do a whole other video on EMG if you'd like, but EMG is one. A muscle biopsy is another. So with a muscle biopsy, it's exactly what it sounds like. It is done usually, you know, an outpatient, or sometimes right even in the doctor's office, and they'll take a little punch biopsy of the muscle. Usually you'll have a local anesthetic in this case, because it can be rather uncomfortable, but they'll take a small piece of the muscle and look at it under a microscope in pathology. And they'll look for certain hallmarks of muscle destruction, certain ways the cells have been affected by, if it is myositis, whatever is going on there. But yeah, so EMG, muscle biopsy, physical exam. And then last but not least is an MRI, magnetic resonance imaging. So everybody, I'm sure, knows what an MRI is, but unlike an X-ray, an MRI can actually show soft tissue. So that's why your doctor may order that as well. And then based on all of this testing and in combination with the physical exam that your doctor does, you may find this diagnosis. So now if somebody is diagnosed with this, what do we do? How do we treat this? And the first line of treatment typically is corticosteroids, unfortunately. I mean, I've always said corticosteroids have their place. It's just, for a chronic disease. Well, let's put it this way. Some myositis, as I said in the beginning, can actually resolve on its own, depending on the cause. If it is a chronic situation, then you're looking at corticosteroids to reduce that inflammation and help your body hit the reset button. So aside from corticosteroids, then we also use disease modifying agents. These drugs basically, they've come out on the market over the past several years, and it seems like every time I turn around, there's a commercial, one here, one there for one of these medications. But in this case with myositis, this is the next step that we would take a look at. So corticosteroids and immune modulators. And both of these can be taken orally or intravenously. So the steroids or the immunomodulators can be in pill form or infused through your vein. And then last but not least is IVIG. And if you don't know what IVIG is, you might want to check out some of our other videos, because I've done a whole series of IVIG, what it entails, what it's about. It's a miracle drug. It is a blood product. So check that out if you're wondering what the heck IVIG is. It stands for intravenous immunoglobulin, and it is typically given through the vein. It is an infusion, can also be given subcutaneously and self-infused. So with IVIG, you need a healthcare practitioner to administer it. With sub-Q IG, you are taught by a healthcare practitioner to administer it, and then you have a little more autonomy going forward doing your own infusions. But IVIG basically has anti-inflammatory properties. It is, in any type of autoimmune disease, there is an autoimmune response that has gone haywire. It's gone off the rails. And IVIG, it's giving the body a surplus of normal antibodies and kind of bolstering your immune system. And it just really, it does wonders for people with myositis. Many, unfortunately, will be on lifelong IVIG therapy. But yes, so they're the three main treatments for myositis. So who treats myositis? If you're watching this video, or you have a friend or a family member with it, or if you're sitting here thinking, well, I haven't been feeling too well lately, and I need to know what this is, always start with your general practitioner or your nurse practitioner. And then from there, it's usually a rheumatologist who specializes in inflammatory conditions of the body, autoimmune disease. These are your docs that will take care of you with, rheumatoid arthritis and sometimes lupus and all of those types of diseases. Because of the components and the way some of the myositis present, such as dermatomyositis, you can also have dermatologists who will take care of anybody with myositis symptoms. Because of lung involvement, you can also have pulmonologists or lung doctors who see patients with myositis. Neurology is another huge one because this is a disease that is involved with the innervation of the muscles, and a lot of neurologists will see these patients as well. There are generally huge practices, and usually in those practices you will have a physician or an NP who actually specializes in the diagnosis and treatment of myositis. So if you are venturing into maybe seeing a physician for these symptoms, or if you've already been diagnosed with myositis, you definitely want to see somebody who actually specializes in this. And by me, we have a huge myositis center. Johns Hopkins is very, very big into myositis. And they have excellent physicians there that really care about their patients and really do a lot, to help and understand this whole disease process. So very important to, again, find somebody who specializes in whatever type of myositis you may be dealing with, or if you just want to know more about myositis, then that's where you would look. And then last but not least, one of the things I want to go over are the support groups. So myositis is such a specialized group of disease states that there's never enough support for these. And that's one of the things that I definitely want to focus on is anybody watching this video. There are walks, there are local support groups. Some of you may have family or friends, or maybe you're healthcare practitioners and you just wanted to watch this video to kind of get a general overview of what myositis is. But I encourage anybody who comes across this to jump in and look into some of the local support groups. There's usually walks. There was a local event called Fun Fit Flex, and a lot of these groups do a really great job of raising awareness and funds for research. So important. I can't stress how important it is, but I hope you found my overview of myositis today informative, and again, let me know which disease you would like me to cover for August. And if you have any questions about anything I went over today, or if you want to correct anything that maybe you think I said incorrectly, bring it by all means, and I will see you in the next video.